Hi there, I'm Dr. Audrey, a board-certified and fellowship-trained refractive and cataract surgeon, an ophthalmologist, and cornea specialist. And today, I'm here to talk about cataract surgery. It is a big part of my practice, and I want to give you the inside information on the side effects of cataract surgery that your cataract surgeon might not have told you before your surgery. I will also tell you everything you need to know about how, with the right surgical approach and preparation, not only can the risks of those side effects be significantly reduced and even avoided entirely. In this video, I will also reveal some tricks that I use as a cataract specialist surgeon to help my patients avoid some of the common complications and side effects of cataract surgery. With any complex surgery, it would be almost impossible for your surgeon to go through every possible scenario. That's why I'm here today to share 5 secrets you might not know about cataract surgery. But first, don't forget to subscribe to my channel and turn on the notification bell so you won't miss any of my upcoming videos on eye health and eye surgery. Secret number 1. A significant minority of patients experience some degree of dry eyes after cataract surgery, with reported rates ranging from 5% to 50%. Such wide variability is mainly due to 3 reasons. The first reason is differences in the type, frequency, and duration of postoperative medication eye drops. Post-op medications can vary widely among surgeons. Shortly after eye surgery, you often need to use 2 to 3 different prescription eye drops frequently for 1 month after surgery to prevent infection and reduce inflammation. And so many drops can disrupt the normal tear film on the surface of the eye, causing temporarily dry eyes after your surgery. In addition, if you're prescribed eye drops that contain preservatives such as benzalkonium chloride or BAK, those preservatives can cause damage to the surface cells on the eye, making dry eye symptoms worse. In order to prevent my patients from developing dry eye disease after cataract surgery, I prescribe my patients a 3-in-1 combination preservative-free medication eye drop to use before and after surgery. Each eye drop contains 3 medications: an antibiotic, an anti-inflammatory, and a steroid medication. This regimen reduces the total amount of eye drops needed and avoids damage from harmful preservatives. The second reason is that the size of incision made during cataract surgery varies among surgeons. The larger the incision, the more damage to the corneal nerves, and those damaged nerves cause dry eye disease. For my cataract patients, I create a microincision of no more than 2.4 mm in length. This microincision size minimizes the damage to the nerves in the cornea, the clear windshield of the eye, and it helps prevent dry eye disease after surgery. And the third reason for the wide variability in dry eyes after cataract surgery is that patients who have pre-existing dry eye disease before cataract surgery may not have been diagnosed or optimally treated for their dry eyes before their surgery. For my patients, I pay close attention to catch any dry eye disease during their initial surgical consultation visit, and I prescribe them with a personalized dry eye treatment regimen to make sure their dry eyes are optimized before having cataract surgery. To learn more about this topic, you can watch this video. Secret number 2, droopy eyelids, also known as ptosis, has been reported in anywhere from 0 to 21% of patients after cataract surgery. The chance of developing it again depends on the surgical technique used. During cataract surgery, an eyelid speculum is used to keep the eye open, and as a result, the eyelid muscles can be overstretched and lose their elasticity if the eyelid is stretched open too wide or the surgery took a very long time. And this can cause a droopy appearance. To prevent eyelid drooping, it is essential to limit the duration of surgery and avoid overstretching the eyelid with the speculum. Also, if you already have droopy eyelids and you're considering eyelid surgery, it's best to wait until after your cataract surgery. For a temporary fix, you can explore Opnique, a daily eye drop that helps with short-term droopy eyelids. Secret number 3, unwanted visual phenomena called dysphotopsias can sometimes occur after cataract surgery. This can be categorized as positive dysphotopsias, such as glares, starbursts, rings or halos, or negative, such as arc-shaped shadows. Up to 50% of patients may experience some temporary dysphotopsias right after cataract surgery. But fortunately, at 1 year after cataract surgery, only about 0.2 to 3% of patients still have dysphotopsias. Dysphotopsias are often related to the design of the lens used to replace your cataract. And you guessed it, the surgical technique when aligning your implant. As a refractive cataract surgeon and a cornea specialist, I take special care to examine pupil size, corneal regularity, and shape before surgery to lower the risk of positive dysphotopsia. Large pupils or irregular corneas can increase the likelihood of positive dysphotopsias after surgery. For those patients, I avoid implants with higher risks for positive dysphotopsia and help the patient choose an implant that will have the lowest risk. During surgery, I carefully align the center of the implant to the visual axis of the eye to reduce glares after surgery. To lower the incidence of negative dysphotopsias, I often counsel my patients to choose implants with large optical zone and avoid implants with a slanted edge. Secret number 4, posterior vitreous detachment or floaters. Floaters are clumps of collagen fibers formed in the jello-like material called vitreous gel, which fills the cavity in our eyes. Those collagen fiber clumps move with the eyes, and when they're near the center of your vision, you can see them as gray structures such as bubbles, strings, cobwebs, or dark spots. Floaters are very common after age 50 and become more prevalent with age. Studies have shown that cataract surgery can increase the risk of developing floaters. Although floaters are so common that most people have already developed floaters prior to having cataract surgery, although there's currently no way to prevent floaters associated with cataract surgery, I ensure my patients are well informed and prepared for the risk of developing floaters after cataract surgery if they don't have floaters yet. I also make sure to review with them the signs and symptoms of retina tears and retina detachment, which can occur with new floaters, so they know what symptoms to look out for and feel fully prepared for their cataract surgery. Secret number 5, posterior subcapsular opacity or PCO. Think of cataract surgery like removing the chocolate from an M&M, leaving the collagen shell behind to hold the implant. This collagen shell can develop some scar tissue, affecting 20 to 50% of patients within 2 to 5 years after cataract surgery. This is often referred to as secondary cataracts because it causes similar symptoms to cataracts. Symptoms include nighttime glares, decreased vision quality, or blurriness. The good news is that treatment is quick and simple. YAG laser capsulotomy can permanently treat the scar tissue when needed. It takes less than a minute, and no downtime or medications are needed before or after the procedure. Once the scar tissue is removed, it doesn't come back. If you or someone you love is considering cataract surgery, make an appointment to sit down and discuss it with your eye surgeon. My cataract surgery patients often tell me that their decision to restore and design their vision was positively life-changing. The joy I see in my patients' faces after the surgery is incredible, and many wish they had it done sooner. I hope this video answers some of the questions that you may have about cataract surgery. And remember that you should always consult your eye surgeon for any specific questions about your surgery. If you have learned something new, please consider hitting the like button and subscribe to my channel to support more informative content on eye health and surgery. You can also follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you again for watching, and I will see you in my next video.